Now, this is a somewhat shocking slide. And I wanted to point out the little yellow bell in the lower right-hand corner. This slide was put out by the Australian Tea Party. And I just want to read it to you because it's difficult to read perhaps the bottom part. But it says, Obamacare, the practical reality. Socialized medicine, die while you wait. America, you have no idea. DMV queue, very quick. Post office, very, very quick. Obamacare, knee replacement, 3+ years and counting. We know. Socialized medicine equals wasting people's lives and killing them to hide costs. Death by bureaucracy. Now the Australians, they really put it right out there. Again, a big concern. Now, I shouldn't say a new issue, but an issue that has gained new attention lately is Medicare. And if you go to the Obama-Biden website, there is a video on strengthening Medicare. And this video discusses closing the donut hole of Medicare D insurance coverage. So if you're looking at your prescription plan, it pays 75% of the first $2,830, and then it covers 95% above $6,000, but in between there's no coverage. So that's the donut hole. So under PPACA, this donut hole will gradually close. So it sounds good, but at what cost are we going to pay to close the donut hole? $716 billion, because that's what's being cut from Medicare to implement PPACA. Provider payment cuts are estimated to be over $400 billion of these savings in Medicare. And I could tell you with the sustainable growth rate, which is something that comes before Congress every year regarding physician payments, that will come into effect this year, or scheduled to, and that alone is going to cut provider payments 26% this year. So, what effect will this have on access for our seniors? Especially when you consider now that approximately 75% of doctors currently either limit or opt out of Medicare. And I know as a hand surgeon in a large medical group, we don't distinguish. We see Medicare, Medicaid, private, no insurance, does not matter. And I will say that even just as a hand surgeon, as a surgeon who episodically takes care of a patient for their carpal tunnel release or their wrist fracture, I have several patients every year who come up to ask, Dr. Triepel, can you please make a recommendation for a Medicare provider because I can't find one? They're having trouble. So no discussion of Medicare today would be complete without mentioning Paul Ryan. I would say that he is probably the big reason why now Medicare has been thrust into the spotlight, because he has a plan to preserve and sustain Medicare. And in this plan, basically discussing transitioning Medicare from a defined benefit to a defined contribution. And there's no change to any patient that's greater than 55 years of age now. Currently, if Medicare continues as is, obviously it's going bankrupt. I would put out there with PPACA cutting $716 billion and instituting a rationing board called IPAB. That's not best for our seniors. This creates the most choice and sustains and preserves Medicare for years to come. I put up this slide, it's a popular slide, and it's to show the person in the center. This is to introduce her, the Secretary of Health and Human Services. Now, if you look further up to the yellow diamond, you'll see the IRS. This is our new healthcare system, this chart. If you look in the upper left-hand corner, you see the President. Upper right-hand corner, Congress. You see IPAB in there, over to the left. And you see the Patient-Centered Outcomes Research Institute in there as well. Now, if you look way down at the bottom, you see marginalized physicians, and on the other side, patients, because our new healthcare system is not about physicians and patients. It's about the government. So Kathleen Sebelius, Secretary of Health and Human Services. She is the second most powerful person in the United States behind our president. Oh, by the way, she's the former executive director of the Kansas Trial Lawyers Association from 1977 to 1986. She is an insurance commissioner, and she will determine the quality and standard of our health care and will oversee the implementation and enforcement of PPACA. So what I see is a schizophrenia here with what we're being told and what I see as a reality. With Sebelius and PPACA proponents, they say preventive care is free. But we'll get into this in a few more slides. There are $500 billion of new taxes. To me, that's not free. Kathleen Sebelius says we're building and expanding community health centers. But again, we'll get into this in a few slides. There's a very real healthcare shortage with doctors, and that's without PPACA. And then we had the proponent saying we're closing the Medicare donut hole, but we're also cutting $716 billion from Medicare and have the implementation of IPAB and rationing. So again, we return to this busy chart. Let's discuss what the PPACA proponents aren't saying. Does PPACA achieve its goal? And are there any alternatives? So, does it bend the cost curve down? Because that's what we hear that it's designed to do. And does it cover the uninsured? I'm a physician, I'm a surgeon. I went to medical school not to care for those that have insurance. It's to care for patients. Doctors want to take care of patients. We care about this issue. We're going to look at the effects of PPACA on small business, taxes, doctors, and patients. So spending. This is a little bit of a busy slide. But what I did is I went to the CBO website. 2012, they state that PPACA is going to cost $1.5 trillion in new costs for Medicaid, CHIP, which is the Children's Insurance Program, tax credits, and other subsidies for the purchase of health insurances through the exchanges. This is going to be offset by $0.4 trillion, so it's pretty close to $500 billion, $0.4 trillion. And this is somehow going to decrease the deficit by approximately $138 billion over 10 years. Now, apparently, I have heard that the CBO has accounting rules that allow for the Medicare cuts to be counted twice. And somehow, that is legal for the CBO. But in reality, it wouldn't work for our checkbooks. Now, Charles Blehaus is a public trustee of Medicare, and he has said recently that PPACA will increase federal spending by more than $1.15 trillion over the next 10 years, and it will add, not take away from, but add anywhere between $340 to $530 billion over the next 10 years. Let's look at the uninsured. There are approximately 47 million. And this was a study done by the Republican Policy Committee in 2008. And if you look at this pie, there's two halves. There's the bottom half and the top half. I like to look first at the green slice of the pie. Green slice of the pie, approximately 9 million patients, individuals earning more than $75,000 per year. These are likely some of the more healthy new graduates, get the good jobs, they don't have insurance, but they could purchase insurance. So that's 9 million out of the 47 million. We're going to move down to the bottom of the pie, another 9.7 million patients that are eligible for government programs, such as Medicaid, and they choose not to enroll. Then we're going to move one more slice to the beige, and you'll see there's approximately 6 million patients who are eligible for employer-sponsored programs, and again, choose not to participate for whatever reason. So that 47 million uninsured now becomes roughly 23. Now we'll move to the top half. You've got 5 million legal immigrants, approximately 5.2 million illegal immigrants, and the orange slice, 12 million Americans without affordable options. So whether you look at it as 12 or whether you look at it as 23, this is what we want to carry forward. Currently, we have approximately 250 million insured Americans. And whether you call it 12 or 23 or even the number that's commonly batted about in the press, 30 million, you can see that it's around 90 to 95% of Americans are insured, 5 to 10% are uninsured. So, CMS analysis in April 2010, 1 month after the bill was passed. By 2019, after full implementation of PPACA, 23 million Americans will still remain uninsured. So I put out there, what have we accomplished with 159 new boards, agencies, and committees? What have we put out? What have we accomplished with a 1.1 or 1.5 trillion dollars, depending on the day? What have we accomplished if, after full implementation, we still have 23 million Americans that are not covered? This does not change the level of the uninsured, and it adds an unfathomable level of bureaucracy and cost.